My name is Kelsey Stavseth, and I'm the Executive Director at Northeast Kingdom Human Services. And today is really to celebrate the journey of getting to opening what we're calling the Front Porch, which is a mental health urgent care. And it's voluntary. It's meant to be walk-in. It's for youth through adult. And ultimately, it is meant to be a therapeutic, purpose-built space to meet people where they're at, and to have a physical space for people to go that alleviates the burden on the hospitals, the community, and a safe space for people to go to get the right service. So we'll have peers, therapeutic clinicians. We will have access to psychiatrists and advanced practicing nurse practitioners, although we don't anticipate doing too much of that. And that it's really meant to emphasize the importance of physical space in creating a calming energy, essentially, or environment, so that people can come in, relax, and then get the services they need. But they know that there's a place where they can come, where people are well trained, and that the space is built for them to come when they're in emotional or mental health crisis, including suicidality. Today is the open house, and so we're opening Monday. It's a soft open, so we'll be open from 7 a.m. to 11 p.m. 7 days a week. And so we have hired staff. Ultimately, this will be a 24/7 facility that does have crisis stabilization space, so people will be able to stay from 2 to 10 days. It is not a residential facility. I want to be really clear about that, but just like people board at the ER until they can get the right service, we are a voluntary crisis stabilization space that will be able to have people come and go as needed until they get either inpatient, which is what they need if they do need that, or other services. But we are meant to be an interim stabilization center where people can walk in or be referred from the community or other folks. Good. And that's the front porch. And so that's our staff. And so, this is the part that we're using right now. And so there are some therapeutic rooms right here. And so they're named after different towns in the area. So we've got Newport, got Morgan, Burke, and Willoughby. So that's really specific, and so this will be the main area that we're using right now, and then you'll see some other empty spaces that ultimately this will be a children's area, this will be the crisis stabilization area and group living room area over here, but right now we're prioritizing, we know the need has been here for many years and we wanted to open, so we're doing that in phases. So ultimately this is the phase that's going to be open right now, and then we're going to do construction in phases and hopefully as soon as possible.
So phase one is just, you can come in if you need immediate help.
Yep. No overnight.
There's no beds or anything yet.
Yep, just the urgent care piece right now.
Urgent care.
Yep.
Perfect.
So,
awesome.
So I can show you all the rooms are the same, but this one's called the Newport room, and so ultimately, if someone comes in, we can just have them come right in. We've got, if a peer or clinician needs to meet with them, but ultimately coming in, you can turn this off, you can relax. And so this is the purpose-built specific therapeutic space where people can watch TV, you can just sit here. It's temperature controlled, so you have control of that. And so really it's about when people are dysregulated or need support, what can they control? And this room is meant to be, you can control your environment. You can hang out here until you're ready to engage with somebody. So whether that's a peer clinician, and then really hoping that the environment is part of the treatment and to come in and just feel relaxed.
It's very calming, yeah.
I agree. I sat in a chair. You're welcome to do that. It's very nice. Kick your feet up. So
I don't know. I don't want to fall asleep.
Yeah. So it's really meant to be relaxing and supportive.
Awesome.
And yeah, so you can get shots of
that looks like an office.
It is. And so this is meant to be a flex office. So this is Tesla Hubbard, who is the program manager, will be overseeing that, and who's here today. But can be used if we've got a need. But there's these three others which are
just like the Newport room. So we got Morgan. Oh, it's exactly like it with a picture of Morgan.
Yeah, exactly. That's what it's set up. So we got Burke and
Burke.
Picture of Burke.
And Willoughby. My favorite lake.
I know, it's so beautiful.
Very cool.
The idea is if someone's coming in crisis, they can have their own space. They're able to control the temperature, watch TV, but just like relax till they come in. Then we can have a peer or a clinician come and just have a conversation, see what they need. So, yeah, that's the intention. Yeah, try it out. I did it earlier. Put my feet up. It's real nice. So if you're feeling stressed,
I was looking at that
down.
Russ. How is it?
jeez, girlies.
Right?
Yeah. Look at that.
Oh, there you
Oh my God. Look at that.
and then you can get the.
Yeah, can I stay here?
Yeah, sure. We'll be back in a little bit.
That's nice. What a beautiful room.
Yeah.
What a beautiful room.
And so, it's, we're trying to alleviate pressures on the hospital and law enforcement. And so, and this also works with our mobile crisis program. And so we currently have people doing embedded shifts at Newport PD, Hardwick. We're trying to get it going in St. Jay and saying, we can go with them, and then if we need to come here, we can, or if not, that's in the community. So.
Knocking it out of the park, man. We're actually working on a recovery place right now. I just actually left a meeting as far as for that. So that's a little bit, it's getting closer and closer every day. I've had like 3 meetings on it. So, with what you guys are doing and what the community's doing, we're going to be a leader of the state. So thank you. Thank you guys for doing, thank you. Thank you for everything. So it's very, very, very impressive.
Give
Nice,
a good thank
beautiful
you
rooms.
to Tesla.
Yeah.
She's
Yep.
a big part of this.
So it's stripped down, and we will remodel this whole thing.
So this will be where rooms are?
Yeah, I think this room's coming out. We'll have like a little area over here, but there'll be 2 beds on that side, 2 beds on this side. There'll be a living room, kitchenette, hangout space, and then this will be group space back in there where people who are staying here coming can, but that'll be like regularly scheduled. People can come, and so we're really trying to maximize the natural light and utilize the space. But it's a perfect building. It's just a rectangle, and so hopefully it won't be too hard to renovate. So first of all, my name is Kelsey Stavseth, and I'm the Executive Director at Northeast Kingdom Human Services. And I just wanted to thank everybody for coming out today. The weather made it very easy. We were a little worried about rain, but it came and went, and so we're appreciative of that. But the first thing I do want to say for thanking the community member is really thanking everybody that was a part of that, and that takes the whole NEK community, the state of Vermont, and all of the committed people who have been working on this for so long. So today is a few minutes, a few hours of celebrating work that started over 7 years ago, even before that. But two people that I really do want to acknowledge is Betty Barrett and Chris Barrett. That really got kicked off. So Betty and Chris over here. Yes. And I think it stems from the experience of having a need, either personally or with a family, for a place like this. And that passion was used, and the energy was used over many years, and was one of the first things that I took on when I started in 2021, is saying, you know, the Barretts are having a meeting with the state, they want this to happen, and pretty much picked that up right after I started. And it's been a wild ride to get where we are. A few other people that I want to thank is the staff who are going to work here. They have been hired, they've been working together as a cohort, so they're standing over here, a few of them, not everybody. So they have been hired, training together, learning together, working together, practicing on scenarios in here, helping develop the space, make it as beautiful as I think many of you have been in there already. We'll do a tour after this, a little more guided. But we couldn't do it without the people who are going to be doing the work, and we must not forget that and celebrate them as well. Also want to thank our community partners, who I see many out here, a lot of regular faces from schools, recovery centers, legislators, the state of Vermont, Department of Mental Health. The governor's office has been really instrumental in making this happen. And so a year ago, it was in the governor's budget, it was put in the legislator, and it was passed. And one of the only reasons we can make this happen is we need resources, and they came through for the Northeast Kingdom, which we're really grateful for. And so I just want to say that although we're standing here as an organization that is responsible for this, that we couldn't do it without everybody here and the many other people and organizations that helped get it over the finish line. So just sincere and deep gratitude for everybody who's been helpful in that process. And so one thing that I do want to add is that this is really a cornerstone piece in the mental health supports that we need to bring to our communities. But this has been done with intentionality and adds on to other programming that we've had and complements it closely. And so I do want to acknowledge that we have 988, which is 24/7. Pick up the phone, call 988. You're going to get a person, most likely in Vermont, but you'll always get a person. We cover that, and then with our sister organization, NCSS, which is another designated agency in Northwest Vermont. So we cover that, and we are able to support people, but also get services to them. If we need to send somebody out, we have Mobile Crisis, which is a 2-person response. So that was stood up in conjunction with the state and the other designated agencies starting January 1st. And so it's a continuum. And we want people to be able to call a safe, supportive line, get people to go out to them in the community, and if needed, come to a physical space that is built intentionally, therapeutically, to meet their needs. And so I know many of you have already gone in, but we'll go in again. And the first phase is the urgent care phase. And the space is really intentional. It's meant to come in and saying, we think about services as a person that you talk to, which is really important, but we also know that physical space can help with regulation and is part of the therapeutic process. And so everybody we talk to is saying it has to be nice, it has to be homey, it has to look like a home, and that's one of the reasons it's called the Front Porch. So give credit to Josh Burke, our Emergency Services Director, for coming up with that name, but it's meant to model what it's like to go to your neighbor's house, come up on the porch, have a conversation, and if you need more support, you can come in. But this is intended to be open 24/7. We will be opening Monday on a limited basis from 7 a.m. to 11 p.m., 7 days a week. And then as you can see behind me, there are architectural and construction plans that we will be working as quickly as possible, given all the pressures around building, to make that happen. And ultimately, we're going for 24/7, 365. We will be open with crisis stabilization beds. So this is not a residential facility. It is voluntary. We'll work in conjunction with partners like local PD, VSP, the hospitals, other community organizations to make sure people know how to access this and then access it when it's appropriate. We still need our partners. And again, this is not an inpatient facility. It is voluntary and meant to meet people where they're at and give a physical location that is different than the hospital, where we work closely with and know that there is immense pressure on the hospital to support folks who should be coming here. A couple things. I do also want to say thank you to the city of Newport, going through the zoning process, working with the Hogans, who was the physical therapy building, who worked here, very supportive, in that it was intentional here. Newport saying there's a need here, there's a need in the far northeast, and that the town and city have been supportive, and the other place. So I definitely want to thank them. Let's see. And so the last thing I want to say is that not only is this therapeutic, it's an intervention, but it is meant to contain the core values that are really important to us. And so saying, we get questions a lot. There is stigma associated with mental health, substance use, and saying, you know, if you build these things, if you have these things, you're going to bring people in who are dangerous. And what we want to say is, the people are here. And I was talking to Senator Ingalls and saying, we want to support our own. And it is really important, and part of what we advocated for is saying, this is for people that live here, they're already here, they need the space, and that as good stewards of our community, we want to support our own community members. And so the dignity of coming here, that mental health is healthcare, and I think this investment from the state and the physical location where it is emphasizes that. And so there's a deep sense of care and dignity for the people that will be coming here, and we want to advocate for that. So again, I just want to welcome you here and thank you for coming. And I will now turn it over to Monica Hutt, who's the Chief Prevention Officer and the liaison between the Agency of Human Services and the Governor's Office. I think I got that right.
And thank you to Erica, who actually found a podium for me, because she knew I wasn't going to be able to manage wind and notes and a microphone all at the same time. It's just not in my skill set. So it is my very sincere pleasure to be here with you today with this soft launch and opening of the Front Porch program. You know, conversations about mental illness, and probably more importantly and more appropriately mental health, have been happening in Vermont for many years. And those conversations have really evolved over all that time. You know, we started with institutionalization and inpatient care, partial hospitalization, community-based care, and pretty much everything in between. And the treatments and supports available have developed over time, and the specialties and trainings of all of our mental health professionals have evolved to keep pace with all that change. So there's a lot we've learned over the course of time, right? We've learned about the importance of the right care at the right time in the right place. We've learned to really value the role of community and the ability to receive care close to home. We recognize the importance of an equal, balanced focus on both physical and mental health. And we've really begun and learned to appreciate and lift up the role of peers, of families and friends in the health and well-being of the people that are seeking treatment. In all of that positive growth and recognizing all that we need to value, we also were really clear and began to identify what wasn't working very well, where there were bottlenecks in the system and a lack of options and a lack of choices. And sometimes those bottlenecks and lack of options and lack of choices led to some pretty tragic outcomes for people. We also figured out where our systems were overtaxed and unable to meet the needs of children and families in our communities. Emergency rooms and law enforcement have been engaged all too often recently in our state because other options just didn't exist. And although all of those entities were willing to step up, they were doing more than they could with not enough resources, and it was really compromising their ability to do the work that they were supposed to be doing. What we know is that small issues without the support to get to resolution become really big issues. And like any illness, mental health has a ripple effect. It starts with individuals, it touches partners, it touches our families, it touches entire communities. And communities often are the ones that are feeling those gaps most acutely. So the idea of a place that would use a peer workforce right alongside clinicians would build on the concept of a living room model, which is a classic mental health approach, and is designed innately to steer away from emergency rooms and to steer away from the engagement of law enforcement. A mental health urgent care, a walk-in clinic, essentially, which will eventually house more than just this support service for NKHS. So a lot of crisis services will be housed and deployed from here. It's the next evolution in our learning and growth. And it's a response to us collectively figuring out what wasn't working very well. And that's absolutely something we're celebrating today. I know from my work with the Department of Mental Health that collaboration, a willingness to engage and identify the problems and solve them as they came up was critical to getting this project done. I also want to offer my thanks and the governor's thanks to Betty and Chris Barrett. One more time. Your passion and your advocacy for this work is really what was instrumental in making this happen, so thank you for that. I also want to celebrate Kelsey and his entire team for their vision in moving this project to completion, and the board of directors for NKHS, who I'm sure had to suspend disbelief and continue to support this project through a lot of ups and downs. I would be remiss if I didn't offer my thanks to the team at the Department of Mental Health, who continue to advocate for a continuum of care across the state of Vermont and who lent their support to this effort. And finally, I don't know if you've heard, but sometimes it's hard for the state of Vermont to open up new programs in places. And I am so grateful that Newport is the kind of a community that would embrace and stand behind this kind of work. That's not always true, and it's absolutely something to be proud of. It takes a village to support mental health for each and every individual, and Newport is clearly that kind of a village. So congratulations.